to diagnose medical conditions based on what we see in a blood sample. The value of live blood analysis is not specifically to diagnose medical conditions, but rather to uncover and identify imbalances in the system that often actually precede a diagnosis of a medical condition. So as we know in the field of natural medicine, there's a long history of processes and things and imbalances that take place for over a long period of time before any diagnosis or any actual disease actually gets or sets in. And live blood analysis allows us to identify all the underlying imbalances that actually allow for those diseases to develop. So extremely valuable in the field of preventative healthcare, where we can identify things many years before a diagnosis is made, and where corrective steps can then still be put into place before the diagnosis, when we can still easily reverse the process through some simple naturopathic and nutritional interventions. So live blood analysis can help to identify those imbalances, and that also allows the practitioner then to track and monitor those imbalances. So in the field of conventional medicine, most doctors have access to conventional blood tests and laboratory investigations. For someone working in the field of natural medicine, those tests and investigations are really of limited value. We're really not able to tell much about the intricacies of health and disease from conventional blood tests. It's more applicable to disease care once someone has a diagnosis, how to identify and then manage that condition. But when it comes to preventative healthcare, those tests are really of very little value. So the imbalances that we identify with live blood analysis really are the fundamental imbalances in the system that help to maintain optimal health. And if those imbalances are addressed, we're able to get the system into a place where the body is able to actually heal itself. This is often what's referred to as obstacles to cure in complementary medicine. Despite someone taking the appropriate combination of supplements and following the appropriate recommendations, they're still not really seeing results. And in those cases, there are obstacles to cure that are really preventing the system from responding in the way that it should. In live blood analysis, it really gives us a very quick glimpse into what's going on at the cellular level. So we're able to identify those imbalances and work with them. These are the very parameters that anyone working in the field of natural medicine need to be able to identify and monitor. These are the things that we actually work with on a daily basis with our clients. So we look at things like the balance between nutrition versus toxicity, levels of oxygenation, levels of oxidative stress, various balances of microbes in the system. So we can see signs of infection, we can see signs of dysbiosis, things like candida, very easily identified with live blood analysis. The test is combined with dry blood analysis, which also shows a host of imbalances that we work with that are often not identified in live blood analysis. And these include things like heavy metal toxicity, degenerative patterns, stress on specific organ systems, deficiencies, as well as excesses in terms of the inappropriate choices in terms of diet and lifestyle. Many of these factors are really what we often refer to as self-inflicted because they really are brought on by the incorrect choices in terms of diet and lifestyle. So people following dietary patterns and a lifestyle that's not really conducive to optimal health. And live blood analysis helps to identify where those issues are and helps us to correct them and, of course, monitor them during the course of treatment. So there is a long list of anomalies and imbalances that can be identified. I can provide a few that we usually look for. As I mentioned, toxicity. pH is very, very important. We can see whether the system is functioning in its optimal pH. Various vitamin and mineral deficiencies, digestive imbalances and issues with digestion. There's a very foundational understanding in complementary medicine that a lot of our state of health is determined by the health of the digestive system. So a lot of it comes down to what's going on in the gut. And in live blood analysis, we can really filter down and work out exactly where the issues are in the digestive system. Also other hormonal imbalances, things like adrenal stress, very common, seeing signs of adrenal burnout in the blood. And also very interestingly, also the white blood cells, we're able to see various indicators for the immune system because it's actually all live blood that we're looking at. We're able to actually see these cells still behaving like they would inside the body, as opposed to a conventional blood test where the sample is stained and preserved, and they're looking at essentially a dead sample. In live blood analysis, we look at live living cells, and we're able to actually see the activity of these cells. So in many cases, we see signs of an underactive immune system, even in cases where the blood tests may have shown that the indices, the normal levels of the white blood cells are in normal range. There's still an issue with the immune function, because when we look at the actual white blood cells under the microscope, we can see that there isn't really any movement. So the viability of the white blood cells are affected. So very valuable as a tool for anyone working in the field of natural medicine, anyone involved with parameters involving things like nutrition, oxidative stress, toxicity, inflammation, all of these factors that are often related to lifestyle that we understand now are the most fundamental causes for most chronic diseases.